Good evening, YouTubers. It's me, Johnny. I got asked a question too. I forgot to address on my last video. Basically, was do I feel safe in Guatemala and how's the healthcare here? I've been in the hospital 2 times. I've been in the clinic a few times. I had some stitches put in at the hospital, and it went pretty good. Went fine. I went to the clinic to have them taken out. That went fine. Trying to think. Anyways, I think I had I've been to the clinic once when I was sick. I just basically did that just to see how it would go, and it's pretty standard. I just pay for my health care as I go. I don't have an insurance policy, but if you're going to live here long term, you can get insurance pretty cheap, and you can get really good quality insurance pretty cheap too. So if you're a single person, it can be like $30 to $120. If you have a family, it can be like 80 to maybe 200. Like if you have a wife and kids, and I'm saying if you're getting a more expensive insurance, you're going to be getting a better quality. It's going to cover a lot more. If you get like $30, the coverage will be, and you're single, it'll be a lot less. If you're paying 30, 40, 50, $60 for a family, it's going to be a lot less. If you're paying like 80 to like 120 as a single person, you're going to get really good quality insurance. If you're paying a couple $100, it'll include your family and your kids and all that, just for some perspective. Now, I've been in the hospital a couple times. I didn't have any issues. This may be controversial. I've been in the public hospital a couple times during Corona. Well, once during Corona, once another time before that. I didn't have any issues. I just got stitched up there. I went to the private hospital many, many times to get like an EKG, something like that. It's like it's under $20 and maybe $150 for the doctor. So everything altogether is $150. Now, do I trust it? Do I think it's good quality healthcare? Now, for me, it is. I've had very similar experiences in the Philippines, and almost similar prices. So I think the quality of healthcare is good. I think it's really important, though, if you're going to get healthcare, to go to a clinic, meet a doctor you like, and go to many clinics and meet many doctors. Find a doctor that specializes in whatever healthcare needs you need, or you anticipating needing, seeing how their English is, seeing how you get along. Doing that before you're sick is really going to pay off. I think the doctors are pretty good. Not all doctors speak English, but most of them do, especially the younger doctors are going to speak English. And even the older doctors typically speak English. It's not unusual for them to speak English. So go to a clinic, meet a doctor that specializes in the healthcare you anticipate needing, and use it before you need it. Whether you do as pay-as-you-go or whether you do insurance. Now, the best healthcare is going to be in the capital. It's going to be in Xela, Guatemala. That's part of the reason a lot of gringos live here. And they have a new clinic a new hospital that's been here, I think 3 years, maybe 2 years. It's the hospital that's associated with the capital. I can't think of the name. It's La Paz. They don't just have La Paz. They have quite a few hospitals here. That might be considered the best one, or the highest cost one and the best one. And they have hospitals in the capital too, so the doctors will go back and forth. I know a couple doctors there. One of the doctors in the capital, he comes up and practices medicine in Xela like once or twice a week. I can't remember. I think once a week. And I also know other doctors that live here in Xela. They practice medicine once or twice a week in the capital. So that's not really unusual depending on what their specialties are. But try out a few doctors. Like if you're a woman, try out some of the lady doctors here. If you're a man, same thing. Most of my doctors are ladies, and they suit me just fine. That's about all I can say about healthcare. Like, I've been stitched up a couple times. I've been into the clinics for like EKGs. I've been to the clinics just like I was just had a cold or whatever. Just wanted to go in to see how that would work and what it would cost. Like a doctor's bill can be, I can't even remember what it was. I want to say 100 or 150 Q maybe, but it's actually not that much, 20 or 30 bucks. It could be 50 or 60 depending on what hospital you go into, but some of the clinics I haven't been into that I see advertisements for, they're like 50 Q. Most of the time I go in, it's 150, 100 to 150 Q depending on which hospital it is. And most of the time I can speak English with them. Sometimes it's only Spanish, so it's good to practice your Spanish and get good enough so you can express what you need to express if you have some problem. The other question I got, do I feel safe here in Shayla? Yeah, I feel pretty safe in Mexico or in anywhere where there's a lot of tourists and gringos in Mexico and Guatemala. I feel pretty comfortable and safe. If you're going to live here, I would suggest living in a middle, upper middle, well, whatever, what we consider as middle class neighborhoods. Live in a middle class neighborhood, a gated community. I don't live in a gated community, but I live in pretty nice areas, and I don't feel uncomfortable or out of place. I feel pretty safe. Where a lot of the crime is in Mexico or Guatemala, for that matter, or El Salvador, is in the kind of the gang areas, the ghetto areas. Now that can get a little dicey, like where that is and where it isn't. There are places, the gangs can be in Zone 1 in Guatemala City or even here in Shayla, but in general, I haven't had any issue or problem. Most gringos I know haven't had any issue or problem. Now, if you run a business and your business location's in Zone 1, you might have an issue. If you don't do any business, you're just retired or you're just living here as a gringo, earning your living online or offline, I doubt you'll have any issues unless you're doing some kind of brick and mortar business and you're doing it in certain areas. Then you might have a problem. Then you'll have to figure out what you're going to do or not do or whatever. In general, I suggest doing business online and keeping a low profile, and you should run into any problems. But I haven't had any like random crime happen to me or robberies or threatened or anything in Mexico, for that matter, Philippines or Shayla or places like this. I just haven't really had any issues. Now, everyone's going to be different. One reason I really haven't had any problems is I don't really hang out in bars that much. I do go bar hopping every once in a while, but I don't stay out till like 1 or 2 or 3 a.m. in the morning. Now, if you do that and you're a woman, you should be really, really careful and get a taxi. Not only should you get a taxi, you should have that taxi prearranged, someone you've done business with before, someone your friends have done business with before. Your Guatemalan friends will suggest a taxi that's safe. And if I was a woman, I really wouldn't get drunk. But have a taxi driver you've used before that will want to be up late at 1 or 2 a.m. and give you a ride home. There is Uber. I don't know if they're going to be available at that time because I don't hang out that late at night. But what people do here, middle class people, is they use Uber, but a driver they know personally, or they use a private taxi, but again, a person they know personally. That's one thing you need to consider if you want to be safe here and you're going to hang out really, really late at night. No, I don't really hang out that late at night, so I don't have that issue. But if you drink in a bar, if you get drunk, you could have some problems. I know quite a few young ladies that have been assaulted. I'll just put it that way. They've been assaulted, and they were out like 1 a.m. to 3 a.m., and I don't recommend it for women. Some people don't want to hear that, but that's just my opinion. If you're a guy, I know guys that hang out at 3 a.m., nothing ever happens. I still wouldn't get drunk and hang out at 3 a.m. in the bars, but other gringos do and seem to get away with it with no problem. It's just something I would not suggest if you want to be safe. Like the most likely scenario where you're going to have a violent crime or assault against you, especially if you're a woman, is being in a bar, being late in a bar late at night and being drunk when you leave, getting into a taxi or something, or walking home and getting into a taxi with a person you don't know. It's really, really important to have these things arranged in advance, have used these taxi services before by people you know personally. And again, I wouldn't really be hanging out late at night drinking too much. It's not something I would do. Like if you're going to a dinner party or something like that, and you get done at 11 or 12, you call your taxi service you've used many, many times. That's fine. 2, 3 a.m. I'm not sure. Like I don't know who's going to be up that late at night willing to take you home. But the people I do know, Guatemalans and gringos who stay up 11, 12 at night, they use taxi services or the other service I just escapes my mind right now, but Uber. But they use people they know personally who they used before. It's really, really important to build up trust with people you know. You use the same person. And you, of course, at night you're going to have to pay more than you normally would. And you should do it because it'll keep you safe, because that's one way to get assaulted, by walking home late at night drunk and going into a taxi you just don't know. And I've known a few young women who've been assaulted that way. So the most dangerous thing you can do here is hanging out in bars, drinking too much. Now, there is random crime. I just haven't ever encountered it. Most gringos I know haven't. But if you are going to encounter it, it's usually when you're hanging out in a bar, you get a little bit too drunk, someone sees it, they get on their phone, talk to someone, and then when you leave, that's when you're going to get robbed. Just to keep it real, that's when these things can happen. So as far as feeling safe here, yes, I feel safe in Mexico, but I'm in typical gringo areas. And as far as feeling safe in Guatemala, I feel fine. And shit, even in the capital, I don't feel unsafe. No, in zone 1, I wouldn't be out after 8 or 9. In zone 9 or 10, you can stay out quite a bit later. You can even walk home a little bit drunk. But like if you're really drunk and you got your wallet in your head, you can have problems anywhere you go. But it seems like you have to tell Americans that. They don't seem to understand that. You just can't go out and get really, really drunk and walk home. It's just not something you should do. But in zone 9 or 10, you're going to be okay. There's a few other zones, but in zone 1, around 8 or 9, I like to be in my hotel by that time. But 9 or 10, you're pretty safe. 11, 12, 1, I don't feel comfortable. Now, if I'm in Mexico City, 11, 12, 1 a.m., I feel safe outside at 1 a.m. because there's a lot of people out there. That's the other thing. If you see a lot of people outside and you see women and children outside, you're in general in an area that's safe. If you do not see any, you see people, but you don't see any women and children, only dudes, men, it's going to be a lot less safe. So keep your eye out, like the time of night it is, and when people go inside, especially the women and children, and then who's on the streets. Because if there's women and children, you're generally going to be safe. It's, again, only a generalization. And in Mexico, you can stay out later, in my experience, where there's a lot of high traffic, a lot of people out and about, especially like if there's children and women and like 11, 12, you can still see kids and women out. And if that's the case, you can walk home and be safe. So as far as being safe in Latin America, that would be my advice. Talk to locals just to see what the situation is for the various neighborhoods you're going to be walking to and from. And if it's real late at night, even in Mexico, just take a taxi. And in general, I don't think you should drink too much anywhere in any circumstances. But that's usually when you get hit, because people see you're drunk, they want to rob you. Get a taxi if you can. Try to stay sober late at night. And again, Central America is a little different. To me, you can't stay out as late and be safe compared to Mexico City and Mexico, all the big cities in Mexico, because in general, there people stay out later and there's a lot of traffic on the roads, people walking to wherever they're going, and there's a lot of young people out. So you're in general going to be pretty safe. You're not going to get robbed. Once you get in Guatemala, El Salvador, Honduras, it's quite a bit different. They tend to go to bed early, or they tend to go home early. If you're hanging out in bars and clubs, they're still they're still busy and doing business. But in those cases, you really need to learn to use taxis of people you know personally, used before. And then that's kind of hit or miss. Are they going to be available by the time you want to leave? 1, 2 a.m., they might not be available to come pick you up. So if you can arrange it, have someone pre-arranged to take you home when you're in Central America, if it's late at night. In general, so that doesn't affect me. So that's what I would say about that. So anyways, I just want to put that out there for some of the viewers who want to know about safety and doctors and stuff like that. Again, for doctors, try to find a clinic you feel comfortable in. Go to many clinics. Find as many doctors you can interact with in English to see what their English proficiency is and see their bedside manner. And do this before you need a doctor, so when you're in an emergency, you're not in a weird situation. Now, if there's an emergency, try to have built up a network of friends who can speak Spanish for you if your Spanish is really weak, so they can go with you to the doctor. That's another thing. If your Spanish is weak, have someone go with you to explain, more minute details on what's going on with you, so you can express yourself in Spanish. Maybe you can't, but your friend can. So that's another thing. Or if you can't do that, try to find doctors that you can go to a clinic where they speak really good English. You feel comfortable, so you don't feel uncomfortable in any of these situations. If you have medical needs, you're going to find a doctor in the clinic that specializes in that. So you can just go right there. They speak in English, or you can bring your friend with you. You can get your specialized healthcare needs met. You have an idea what the costs are without insurance, or if you have an insurance, you understand how it all works and what you need to do to use your insurance and all that. So that's what I got to say about that. It's about 11 o'clock here. I'm going to go to bed. Like, share, subscribe, leave a comment. Thank you.